And then the gum comes up like this, and this is what they call mucosa. That's this stuff. And then it turns into gum tissue, and it comes up to there. Now it looks like it comes up, this is where the gum tissue starts, and it looks like it comes up and attaches to the tooth here, but we know that it doesn't. It forms a gum ditch, right? Right. You know what? There's that same shit on both sides. Okay? Now, have you ever had in school or in a dental office, anyone ever had to chew up one of those red tablets and it stained where the plaque is? And did you ever notice that it is right around the gum line and in between the teeth? Is that the way you remember it?
Yeah.
Huh?
It's been years.
Yeah. So you notice it accumulates around the gum line here, right? And up in between the teeth. Kind of like that, right? Now, the reason, the other thing is, did you ever notice when they did that, that there was no plaque up here? No plaque on the teeth? So let me ask you a question. If that's the case, there's no plaque up on the teeth, why are we brushing the teeth? No, it's already gone. You already told me there's no plaque on the teeth. It's down around the gum line and up in between. Well, that's what reason here, but we're talking about from here to here, there's never any plaque. So why are we brushing the teeth? But we shouldn't be. It's a waste of time. And the reason is that the lip comes up here, and the tongue comes up here, and the rubbing action of the lips, the cheeks, and the tongue rubs all that plaque off. So the answer is that you don't need to brush the teeth. But you notice that there is this little thing on the tooth that's called the height of contour. And it kind of gaps over that. And that's why the plaque gathers at the gum line here and in between the teeth. Now it also has a height of contour here. Notice how it bulges out there? Bulges out right about here is the height of the bulge. It's the height of contour there, height of contour there. And so the tongue comes up and it misses this area right in here. Hence why you have the plaque around the gum line and in between the teeth. Because the lips, the cheeks, and the tongue can't get into those areas. So where should we be cleaning? Around the gum line, in between the teeth. We also know that we can get a probe down into this gum ditch, can't we? So you think the plaque can get down there? Oh yeah. Well, no, your decay's up under right about in here. But this is where the periodontal disease starts eating the bone away. So now, what we have now is this whole area marked by the swirly stuff. So we know that we've got number 1 at the gum line, right? Because the lip and the tongue can't clean it. The cheeks and the tongue can't clean it. In between the teeth, right? And lastly, give me an answer here. Where's the last one? Gum ditch. So, it would seem to me, being a fair and reasonable person, that this ought to be the place we ought to be concentrating. No longer we're going to be brushing the teeth. We're going to be cleaning the gum line in between the teeth and the gum ditch. Now, if you look at the way most people teach other people how to, if they do teach, they usually don't, but if they are going to teach, they do what is called a modified bass technique. And what they do is they tip the brush at a 45-degree angle. And what it's supposed to do is it's supposed to come down here and get into this gum ditch. But what happens is the bristles hit here and flex and come down here and flex past it and flex past it and flex past it. And those bristles then knock this out this way. And what happens is this area, because of this height of contour, gets missed again. So what I like to see you do is I'd like to see you go straight into the gum line like this. Now see what happens is if it hits here, it flexes up. Here it flexes up, it gets the height of contour, and then it's going to start hitting the height of contour. And where's that going to bend? That's going to bend down and in. Okay? And you will notice a distinct difference in how that feels. And I'm going to show you that when we actually go to the actual brushing. Okay? So we want to go straight, brush bristles straight in to the gum line. Everywhere. Now, if you look at teeth, teeth are kind of a rounded rectangle. And we'll throw a bicuspid in here, which is even more kind of rounded. So now, this is what this represents when you're looking down here, is if you cut the top parts of the teeth all off. So this is what they look like kind of at the gum line. So now, if you're going in and doing this brushing technique, it'll brush from here to here, here to here. If you floss the teeth and you hold the floss straight, what it'll do is it'll clean from here to here, here to here, here to here, there to there, and there to there. So what do you see? You're missing in there. Absolutely, you're good, you know that? So, one of the key reasons, the reason I show you this, is it becomes very important that you wrap that floss around the teeth and then slide it up and down. Then you wrap the floss around this way and you slide it up and down. You see now you've got overlap in these areas, and then whenever you have overlap, you have more security that you're going to get the right outcome. See there? And that's not a significant wrapping effect that you've got there. All right, so the key thing when you floss, you wrap around the tooth. Both sides, tongue side and cheek side. Or lip. Number one, and number two is floss moved up and down. You wrap it around the tooth. Don't shoe shine. You actually can cut into the tooth if you shoe shine. All right. So there's our flossing. There's our brushing. Any questions about that? Do you think you can do it?